IDIP 2022.
Deepen your
Deepen your
knowledge,
knowledge, empower the
empower the
people.
people. Okay, that was a good
Yay!
one. Thank you for it.
You're very
Okay,
welcome.
okay, guys. So I guess we'll already boost our energy so that we can move to the next agenda. So in the third lecture session, discuss we will discuss about building community resilience in pandemic COVID-19 with Miss Giselle as speaker, and it will be guided by Mr. Roseno Arjangi. Please, Diba, recite the CV of Mr. Roseno. Thank you.
Okay, thank you so much, Sister Risa. Am I audible?
Yeah.
Okay. So I will wait for the operator to share the screen of the curriculum vitae of the Mr. Roseno Arjangi. Oh, can you hear? Oh, suaraku gak dengar. Tes. Guys, am I audible? Maybe one of you can respond on the chat box because I'm not sure if my microphone is on. Oh yeah, okay. Okay, I will recite the CV or curriculum vitae of Mr. Ruseno Arjangi. Mr. Ruseno Arjangi is our Dean of Faculty of Psychology, Sultan Agung Islamic University. He is also our lecturer in here. And then he is graduated from Master of Art in educational psychology from Gajah Mada University, Yogyakarta. And then you can see all of his educational background. And then you can see his relevant work experience, like he is our lecturer in here, and then he is our dean in our faculty. And then you can see awards and grants. He also received a lot of awards and grants in national or international. And then you can see some journal publication from Mr. Roseno Arjangi from international to national publication. You can see a lot of publication that he did, for his journal and publication. And also there are history of conference proceeding of Mr. Roseno Arjangi in local and interlocal. And then here it is, the professional affiliation. He also the part of Himpunan Psikologi Indonesia or Indonesia Psychology Association. So additional information, he speak Bahasa Indonesia and Japanese, and another language is English. So that is the CV or curriculum vitae for Mr. Ruseno Arjangi. So we will deliver this third lecture session to Mr. Ruseno Arjangi. To Mr. Ruseno Arjangi, time is yours.
Okay, thank you, Diba, for introduce my CV. Okay, Assalamualaikum. Good morning.
Good morning, Mr.
Did you hear my voice? Okay.
Yeah.
Okay. Good morning.
Yeah,
Clearly.
morning.
Okay.
Yeah.
Thank you. Okay. Okay. Today I will become a moderator for Miss Giselle, yeah, for Miss Giselle, Grace Galenso Gadies. Before Miss Giselle deliver lecture, I will read her CV. We will know more about Miss Giselle, or in Bahasa Indonesia is Bu Giselle. Hello, Miss Giselle. Good morning.
Morning,
Okay.
sir.
Morning. Okay, in Bahasa Indonesia is selamat pagi. Okay. Okay, Bu Giselle is a lecturer, yes, lecturer in San Pedro College, yeah. As you see in the screens, Bu Giselle still in educational background, Bu Giselle is still in progress in Doctor of Philosophy of Psychology in Ateneo de Davao University, and employment experiments. Until now, she is a faculty member in Psychology Division, San Pedro College, and she has research and publications, and I think she already published in book, graduate research psychology, study of psychology in 2019, and graduate study research beyond the extra mile, exploring the volunteerism of volunteer helpers in flood-related disaster in 2013, and she has a few affiliations, especially related with mental health. Yeah, I think it's her experts. So she will deliver about a lecture about entitled reminder. Entitled building community resilience in pandemic COVID-19 today, because she has related experience, especially in attended seminars, speaker or facilitator related with mental health, stress management, and so on. So I think it's, if I if I read all of your CV, I think we need more time because there are 10 pages of CV from Miss Giselle. I think it's enough. You can see in screens. Okay, okay, Bu Giselle, you will deliver presentations about 70 minutes, and then followed by question and answer or discussion about 30 minutes. Okay, the time is yours.
Thank you so much, Sir Arjanggi.
And
Good morning, everyone. Okay, let me see
morning.
some proof of life right there. If you are truly behind the screen today, can you give me any reaction on this platform? Come on, everybody. Okay, I'm seeing right now 10, 11, 13 heart reacts, 1 sunflower. How about the others? Any reaction that you feel at the moment? Okay, there we have it. Good morning, everyone. Yes. All right. Good morning. Good morning. So I am so privileged to be here this morning with you, having 83 participants with in 9 universities within 7 different Asian countries. So this is truly a privilege to be here today, right? So if you are happy to be here, I'd like you to raise your hand and be proud that you are part of the ID 2022. Come on. That is so right. Okay. So now may I share my screen? All right. Thank you so much. You may now put your hands down. Okay, I believe you can see my screen and you can also hear me well because you are responding to my questions. Now, this morning, friends, we will be talking about building community resilience in pandemic COVID, in pandemic COVID-19. Okay, so yesterday you talked about what mental well-being is, and how does the COVID-19 affected our mental well-being. But this time, we'll take it into a higher notch and would look at it on a community level. What do you think is the level of resilience that your community or your locality is actually showing to the entire country? But before that, let me just check each and every one of you. So I have a few questions, mental health check-ups right here. And I'd like you to write it on our chat box, whether it's a 1 or 1, 2, 3, 4, or 5. Okay, so here is the first check-up. How do you generally feel today? Kindly write 1 if you feel happiest, 5 if not so. Oh, I can see a number 7 right there. Okay, thank you for your honesty. Some are in the average 3. Okay, we are seeing that. Thank you so much. So it's like more of a 1, 2, and 3. Okay, except for the one that put in 7, the level 7. All right, thank you. An average of 2 for this question. All right, so let's go to the next one. How about your academic life? How is your academic life? And I saw a number 8 right here, a number 10 even. Okay. So if you say that it's more than 5, then that means you are struggling right now with your academic life. For those who are in the number 1s, they are at a very good state of their academic life. Okay. So maybe you are so bombarded with a lot of academic pressures. That's why you put in there 5 and more than that. But also I can see in the average level, 3s and 2s right here. Okay, I hope that everybody is participating, and let's see how are you at the moment. Okay, thank you so much. How about this one? How is your love life? With 1 the happiest and 5 the not so. Now you have to remember that it doesn't mean that you're single, you are at a 5, and if you're in a relationship, you're at a 1. It doesn't guarantee that way. Not applicable, all right. Okay, a 5, a 3, single but happy, okay. And there's a 1 right here. Okay, keep it coming, guys. How is your love life at the moment? You can be single but very happy, and be in a relationship but not so. Okay, I think you are done. Oh no, I can't count. Maybe he or she is not sure on the kind of state his or her love life is in right now. Okay, how about this one? How about your life as a whole? The totality of your life. Is it a 1, 2, 3, 4, or 5? Okay. I'm seeing your answer so far. I am seeing 1s, 2s, and 3s. Thank you. How about the others? How do you see your life as a whole at the moment? Okay. Thank you so much for your honesty, everyone. But you know, there are a lot of people today, maybe not in this room, who are actually at their 5s at the moment. And we know that one of the many reasons, one of the most significant reason why a person is feeling this way today is because of the pandemic. That is why we have right now, at the moment, we call the pandemic fatigue. I do not know how many of you are actually or have actually felt this, but let us try to see first what a pandemic fatigue is. Okay, this is the phenomenon in which, or the phenomenon which is giving governments all around the world a big time headache. Now you have to understand that the different governments in different countries are actually, it's taking a toll on them on how to be able to manage and to respond to this emergency public health issue that we are going through at the moment. Okay? It is also the mental, emotional, and physical exhaustion due to the long exposure to a distressing event. Remember, it happened at the latter part of 2019, and here we are right now in 2022. We still see some traces of it, although here in the Philippines, we are actually at an alert level 1 already. So that means there is no such threat anymore. But of course, we still have to keep up with the minimum health standards or the minimum health protocols. But there are certain countries now who are still at a surge because of new variants coming in. So can you imagine the mental, emotional, and physical exhaustion that we all feel because we have been long exposed to this distressing event? And this is also the effect of wrestling with intense emotions day after day that it drains your energy. Probably some of you have been in control of your lives. You planned that at this year I will be graduating. You planned that at this year I will be taking my internship and so on. And then the pandemic happened without any of your control in it. Intense emotions. You've been battling with intense emotions day by day, and that somehow drains your energy. That is on a personal level. But let's take a look at it on a social behavioral definition, taking a look at it on a bigger perspective. So it is the collective exhaustion. When we say collective exhaustion, everybody shares the same feeling of tiredness collectively because of the coronavirus restrictions. And this tiredness brings about, because we are already tired with the many restrictions and so on, it brings about complacency on the part of the people. We get tired and then we just say, this virus is, I think it's a hoax. This is a scam. Maybe this doesn't really exist at all. And so people begin to think that way, and they are now complacent with the virus still around us. And worse, because of that complacency, people now have that lack of cooperation, which in turn, because people are not wearing anymore the masks, they are not succumbing anymore to the minimum health protocols. Therefore, it could spike up infections again and further the pandemic fatigue. This morning, ladies and gentlemen, here are our objectives for this talk. First of all, we are to define what community resilience is. And then we are also going to look at the risks and the protective factors in the community during a pandemic. Now, what are the factors that will increase the likelihood of the disease or the disorder to spike up? And what are those that can buffer it? So those are the risk and the protective factors. And finally, that we may be able to learn ways, okay? Learn ways to build resilience in various communities within various cultures. So let me say that again, that our topic for this morning is building community resilience in pandemic COVID-19. And I hope that everybody of us here are ready to listen, willing to learn, so that we may empower other people. Just like your jargon, we have to deepen our knowledge so that we can empower others. So, now that we are here in the room, we came from different countries, different universities, different families, we have different languages. But what do you think do we have in common? Can you start writing that down on our chat box? What do you think we have in common, all the participants in the room today? We now start writing it in our chat box. What are the things that you think we have in common as people? And no one's starting to write yet. I'm waiting for the most courageous and brave person to start so that others can follow. Yes, I'm seeing there, we are all Asians. We have struggles. We are all thriving. We tend to experience anxiety. Yes, we are all humans, right? We tend to all go through something. We are all trying to survive. That is right. We stayed at home, yes. And some people are still staying at home at the moment. Okay, how about the others? What are the things that we have in common here? Like there are about 84 people in the room. What do you think we have in common? Okay, is there anybody else who would like to key in their response or their answers? We are going through the pandemic, that is right again. Okay. Okay, I think no one else is, okay, we are in a cumulative society. We are collectivists. Yes, we are susceptible to stress brought about by the pandemic. We are humble. Oh, thank you. We are vaccinated, but maybe some are not because of their own personal choice. But at least majority are. Okay, how about the others? We are friendly. Shout out to all who are friendly in the room today. Okay. Okay, now let me also share in my thoughts about this. What do we have in common? So first of all, we all have the same context of the pandemic. So some have answered this. We all go through the pandemic. No one in the world today who has never experienced the pangs and pains of the pandemic. Do you agree with me? We all went through the most threatening parts of it, the highs and lows of the pandemic, right? We have the same context. And because we have the same context, we tend to understand each other. The anxiety felt by other people, the fear of going out, the fear of contracting the disease, the virus, we share the same feeling. Okay? And this has also been said a while ago, because we are in the same context of the pandemic, we all have in common, all nations of the world, we all have the will to survive. Give me a thumbs up sign if there within you, there is that will to survive day by day. Okay? If you want people to survive as well this pandemic, because we all are thriving, we all, day by day, we all are trying to survive, but not just to survive, but also to find meaning in surviving, and that is thriving. Okay? We want to overcome the pandemic together, and that finally one day we want to wake up and then we hear from the news. Are you excited on that day? When you hear from the news, from the national and the local news, that one day the anchor will tell us, congratulations world, we are now pandemic free. Wow, I am so excited as well. And I hope that we can be able to really hear that. And if the virus is still there, but at least it's as easy as flu, and it will not anymore take away precious lives from us, from our families, and from our world. Okay. And the third one we have here is, okay, for a while. Okay. And the third one that we have here is our collectivist orientation. We agree, as Asians, we share the same orientation. We believe in collectivism, okay, more than individualism. That means that we give more emphasis and importance to group goals more than the personal goals. That means that our relationships are more important than our own personal accomplishments. And that when we succeed or when we fail, we know that people are always right there with us. When we succeed, we share our success with others because we know that we cannot do it on our own. That is the collectivist orientation. That's the reason why sometimes, most of the time, it is so hard for us to stay away from home, to live in a different place, to live independently, because we are so much oriented to have our families, our friends, our relatives all around us. So this, I believe, are the things we have in common. But there's one more thing that I'd like to make a statement today. And I hope that you'll stand with me in this statement, that as Asians, we are not a virus. Do you agree with me? We are not a virus. Sadly and unfortunately, some of our Asian families and friends and the Asian people are going through tough times in the Western countries because they blame the Asians for this coronavirus. So whenever they ride in a bus or they just walk through quietly in a store, then some people would go after them and would mistreat them, would abuse them, tell them words that are not good. And it's so sad to be able to see this, especially that we should be united in such a time as this. Let me make it as a statement today for the 84 people in the room. We Asians, we people in the room today, we are not the virus. Okay? Let me start this off with a story of an eagle. As the mother eagle has that or gives birth to its baby eagles there, of course, with all the nurturance, the care, the provision of support, protection, the mother eagle does that to the baby eagles. But a time shall come when the mother eagle would take it to an escapade, okay? She would carry the baby eagle on her wings and they would fly away. They would soar high in the skies, letting the baby eagle see how wonderful, how lovely the world is. Okay? Now, as they move through around and they go through the skies, and while the baby eagle is very amazed of the view, suddenly the mother eagle intentionally drops the baby eagle. So the baby eagle right now would want to thrive and survive flapping its wings, but because it doesn't know yet how to do it, so it goes down and down to the ground. But because the eagle is a mother eagle, so she would rescue the baby eagle, calm it down because of anxiety, okay? She would calm it down and then they would move far away again, fly away up in the sky and see the scenery, and then the baby eagle would feel at ease, and again, the mother eagle would do the same trick, okay? She would drop off intentionally the baby eagle so that the baby eagle will learn how to fly. The mother eagle knows that the eagle, her babies, are not to be nurtured forever in the nest. Their purpose and destiny is to fly high and soar up in the sky. And with that being said, a time shall come when the baby eagle will now know how to fly on its own because of the mother eagle's empowerment and training. the eagle can now fly on its own. What is this story telling us about our topic for today? Community resilience goal is to empower communities to thrive on its own, but not to leave them alone. It is actually teaching the local communities to be able to come up with solutions as a community, not leaving them alone, okay? But it is to empower them, telling them that, or showing these communities, these local communities, that you actually can do something for whatever need you have at the moment. May I just ask, can you still hear me? Because I think on my end, my internet is not fine. Hello? Yes, you can hear me. Okay, okay. Thank you. Thank you so much. Now, so what is community resilience? So from the definitions that we have here, it says that it is the ability of communities to cope with and recover from large-scale emergencies. We're not just talking about the pandemic, but it is about large-scale emergencies, whether it's a disaster, man-made, or acts of God. So community resilience means that this certain locality or community is able to recover and cope from that emergency. That is the persistent capacity to withstand crises and to overcome and rebound from adversity. So that means if you as a community is going through a tough time, you shouldn't stay right down there, but you have to get back up, stand up, overcome, and have a rebound from that adversity. And this is the ability of the communities to self-organize, okay? Not to feel hopeless and helpless, but to self-organize during a disaster and avoid the command and control approach. What is the command and control? That is when the central government tells you to do this or to do that. No, the community resilience is empowering small groups, small communities to be able to stand on its own like the baby eagle. Of course, with the support of the national and central governments, that these communities will be able to thrive on its own. Okay, so it is also a critical resource for governments to consider in their recovery planning. And this community resilience can strengthen and support recovery in many ways, such as it will help the government in appropriating additional finances, public trust, and public support for the different government policies. Now, here are two phases of a lockdown. Basically, these two are not lovers, okay? And they do not miss each other. That's the thing. But they are two different phases of a lockdown. One on the upper left is, okay, maybe you can make inferences from that. But they both are experiencing the same thing, the lockdown during the pandemic. It has been said that economic conditions tend to undermine resilience and affect people's ability and resources to cope with emergencies. While each person has the will to survive and to thrive, but these economic conditions will somehow hamper the resources and the ability of a person to cope. So with that being said, with that statement, let me ask you, who is more at risk at being left behind in terms of help, in terms of the provision of support? From which of the two, okay, you can answer the male or the female or the top or the bottom, you can answer in any way. Who is more at risk at being left behind from the two, between the two? It is who? It's the male, okay? Because if we have to consider the first statement that I told you, it was because of the economic condition. Now, if you are looking at celebrities' Instagram stories during the lockdown, we see that they are in a most optimum part of their lives. No? They're spending their lockdowns eating the food that they want, exercising, spending time with family. But on the other side of the world, there are people who did not enjoy the lockdown, because a lockdown would mean also a locked up of their finances, also a locked up of the daily provision of food for the table. Okay. All right. So now it says here, let me just turn off. Can somebody turn off this mute? Okay. Thank you.
For participant, maybe you mute your voice.
Okay. I think they already did it, sir. Thank you so much, sir. Now, during a disaster or during an emergency, it is where inequities in society are revealed and exacerbated. Do you agree? It is when we see that life isn't fair because the rich people are still getting the best out of everything, while those in the poor sectors of the community, they are very much suffering from what is happening during a disaster, during an emergency. The inequities in society are all revealed. Now, according to Joseph Muturi, as much as this pandemic affects everyone, but from where I stand, people who have been hit hardest are the poor. Now, in the developed world, COVID-19 was just primarily a public health challenge. Okay, it's a public health challenge, but for the poorest of the poor communities, the pandemic has been hugely a destabilizing and a primal challenge, because more than it causing many illnesses and deaths, the economic shockwaves have created primal existential difficulties. That's why there are some TikTok entries that would say, we will not die from the pandemic or from the virus. We will die because of hunger. We will die because we are not eating anything anymore. So that's the reality. It is actually going through in the different countries and societies of the world. Okay? That is what I'm talking about. First, for others, for the developed countries, it is just like that. But for some of the really struggling communities and societies, it's more than that. Okay? Now, let's take a look at the risk factors in the community during the pandemic. When I say risk factor, I hope that you also know the term, right? The risk factor are those factors that will increase the risk. Meaning, if these are present, if these factors are present, then most probably people will get more sick, people will tend to develop disorder more and more because of these risk factors. Now, whether it is a physical disease or a mental health disorder that would affect our mental well-being and our total well-being, let's take a look at the different risk factors in the community, starting off with the socio-economic risk factors. So here we see that minorities and low-income individuals are more likely to be essential workers. And of course, we know that as essential workers, they cannot stay at home. They cannot work at home and work remotely. That means they are put at an increased risk because they are more exposed to the virus outside. Okay, so that's one risk factor. because the jobs of people in the poorest communities are actually in the blue-collar jobs, or those that are jobs that are essential for the needs. That's why they really have to go through on a daily basis. These people also are living in higher density living environments. So the physical distancing will not really apply to them. As you can see, for those living in the slums, there are no distances, there are even no backyards for each family, right? Their houses are closely located from one house to another, that they can even hear their neighbors on the other side of the house. They are living in such a high density living environment. So they cannot practice the distancing that has been practiced as a minimum health protocol. There is also a poor access. They also have poor access to insurance, and the quality health care that they need at the moment may not be given timely, accurately, and appropriately. Poor access to insurance. So when something happens to them, no insurance will pay for their hospital bills, and no insurance will also support the family that has been left behind. Okay? Also, the distance to the medical care providers, especially if you are living in a rural community, and if you got sick, it would take you how many kilometers to get to the city hospital. And also because medical care providers are also getting sick, so there's a dearth of these medical care providers that they cannot anymore contain and accommodate the people who are getting sick because of this pandemic. The fear of anti-Asian violence. I do not know if there are experiences here, of course, because we are the same Asians, but in truth, this is happening to Western upper countries. The moment they see some Asians, of course, we are not generalizing them, but there are some people out there that when they see Asians walking along the streets or wherever, they would be violent towards them. They would attack them, thinking that they are carriers of the virus. And because of this reason, Asians in other Western countries are now prevented to seek help. They are afraid to go to the hospitals. And of course, if you do not seek for help, your condition will worsen even more. Okay? And the tendency to scatter or spread it all over would also be at a high risk. Also, the access to vaccinations. Okay? Some do not have that clear and open access to it. Some also are limited because of the language barriers. They cannot avail of vaccinations, so that's another problem. Financial stressors are leading contributors to suicide, substance abuse, and other mental health issues. Because of the pandemic, okay, we are seeing some reports and some actual research studies telling us that cases of mental health concerns are actually shooting up to a fever pitch. You see, even before the pandemic, people are already experiencing such things, you know, anxiety, depression. But with this context, wherein we are all exposed to these things, it even escalated to a higher level. And the lack of knowledge and lack of government trust. Of course, because if you lack the knowledge, you do not know what to do. You do not know how to cope effectively, and you do not know how to adapt. So that is also a big problem. Now, how about the biological risk factors? Underlying health conditions, like example, primarily you already have hypertension, cardiovascular disease, diabetes, chronic respiratory disease, liver disease, autoimmune disease. Of course, with this, it would mean that it would increase the likelihood of deaths for people who contracted the virus. and even the food insecurity. Okay, when we say food insecurity, that means you are not able to access the appropriate food needed for your with nutritional value. That's it. No? Food insecurity, the lesser access to food that will help you survive and be healthy. Because of this, in many native communities, it has been shown that it is correlated. If people do not eat well and eat right, that is very much correlated with type 2 diabetes, obesity, hypertension, putting these individuals at an increased risk from COVID-19 related complications. And do you know that there are racial differences even in the disease severity? Let me give you an example. Rodriguez had a research wherein the Black people and the Hispanic patients, they represented more than half of all the in-hospital COVID-19 deaths in the United States. There could be a reason why, okay? However, with Asians, we presented with the highest severity of cardiorespiratory diseases. And one explanation for this difference is that in Asian populations, we tend to underuse health services because of fear of racist attacks. So we delay in seeking for medical attention until our symptoms get very severe. And that's the thing. Okay. Now, how about the psychological risk factors? Of course, if there's a pre-existing mental health concern, you know this, okay? If there's a pre-existing mental health concern, it runs in the family. Now, here is a big stressor right here, the pandemic. So it can trigger the already predisposed mental health concern. And the poor well-being and increase in psychosomatic and physical complaints can also escalate because of job loss and job insecurity. So you cannot say that job loss or job insecurity is just about economic thing, no, because people regard their job as life. And because of that, it would hurt them so much if they lose it. It's as if a part of them died as well. And that contributes to poor well-being and increase in psychosomatic and physical complaints. Before I continue, I'd like to check you on how many are still here in the room today. Are you actually learning? Are you still there listening? Give me any reaction. Okay, keep it coming. I hope that you are also trying to reflect on what is happening in your communities, in your country, so that when we make a program later on for community resilience, we have a basis, okay? Thank you so much. Now, also the social distancing and quarantine measures. We know for a fact that this would cause some feelings of isolation, and it is a primal reason for people to feel alone, and it worsens the mental health concern that they actually have because of this distancing measures and quarantine measures that we have at the moment. We also have here the lack of personal support and care. When you are feeling isolated and there is no provision of a personal support and care, then that worsens the mental health concern. Okay? And using avoidant coping mechanisms such as using alcohol or unhealthy habits, this will all aggravate the mental health concern that you actually are feeling at the moment. Now let's go to our protective factors. Okay, so these protective factors are our buffers against the possible mental health concern that could arise from the experience of a pandemic. Okay, and so we have here some protective factors, of course, if you experience or if your family is still in a good economic situation and you are not affected by any job loss, job insecurity, you are still working at home, then of course that will protect your sense of sanity because there is still security on your part. Okay. Higher education is also a protective factor because it is somehow connected with the next thing, the satisfaction with and the level of information that you have regarding COVID-19. Because you do not believe in fake news of what this virus is all about. So you scientifically know what this is all about. Therefore, you are able to manage it the right way. Okay? And you act out of your knowledge, not out of your feelings. This is what education brings to us. It allows us to think logically, analytically. Okay? Another protective factor is the quality of family relationship and social support. Imagine staying at home with a family that do not care for you. Imagine staying at home with a mother or a father who is abusive. You cannot even imagine it, right? And there are some reports that cases of violence and domestic abuse and sexual abuse even escalated during the time of the lockdown because people are inside their homes. But also on the other side, on a lighter note, try to imagine being in a family or staying at home in a family where there is love and nurturance and support. There is a quality of a family, good quality of a family relationship that will ultimately protect your sanity during these trying times. Another is the spiritual support. We all are aware that we do have different faith practices here, but whatever our practices are, as long as we are holding on to hope because of our faith in someone bigger than us, then that is also a protective factor. Also, our self-care behaviors are helping us a lot. The right food that we eat, the amount of time, I hope that we are still sleeping with the right amount of time, okay? And also the supportive state policies, okay? These are all protective factors. If I may also add, here, it says, in one of the study, it says that college-age students and young adults' coping mechanisms to the pandemic are the following: spiritual practices, developing a daily routine, practicing positive reframing, the use of social media and streaming services, journaling, music, reading, drawing, time with pets, and increasing physical activity. They all prove to be protective factors. Now, let me ask you again. I'd like you to write it on our chat box. From the things that I mentioned, what were the things there that you also did during this pandemic? Okay, I'm seeing here time with pets, listening to music, time with pets and journaling, reading, playing games. Okay, keep it coming, guys. Share your ways of keeping up your balance. Okay, meditating, K-drama and K-pop, praying, reading, listening to podcasts, developing a daily routine, cleaning the house before the classes starts. Wow. Okay. What else? Watching drama and online class. Wow, the online class is a coping mechanism. That's right. Okay, watching Netflix, running, taking care of cacti. Okay. What else do we have there? We also have here eating good food, spending time with family. Okay. So did it help you actually? Are the things that you did help you? Yes, okay. It may not totally eradicate the anxiety, but at least it has helped you in a way. That's good. All right. Okay, let's see. How about the older adults? Okay, the older adults' protective mechanisms are the following: self-reflection, reliance on memories. Oh, you're thinking about the good memories of the past, no? And reflections of life experiences. So maybe you are not an older adult, but you're also doing the same thing. You're trying to reflect. You're trying to think about the memories, the good memories of the past. Okay, you reflect on your life experiences and suddenly you see yourself smiling alone. So these are all protective factors and we are encouraging you, okay? You take control of your mental health. Take control of your own happiness in a way that you take care of yourself by doing all these stuff, okay? And hopefully when we still see each other next year, if there's another international convention, we can check on one another and see that we are still flourishing and thriving. All right? And I hope that the pandemic is also silenced during that time if there's another one, another convention next year. Okay. And spending more time outside in daylight was protective for all ages. I do not know how many people are actually doing this, taking some time out under the heat of the sun. Are you still doing that? Or maybe you have been so serious about staying at home that you tend to just stay at home, stay inside your bedroom and not getting in the natural serotonin and natural endorphins you get from actively doing things outside. So please do get some, okay? So it will brighten up your life. Okay, now this is what community resilience looks like in some other localities, okay? Let's take a look at this and probably get some inspiration from the samples that I'm going to let you in here, okay? So some of the things that people do is collecting data to tailor responses. In psychology, we call this as, how do we call this in psychology? That before we give something, before we give an intervention, we give this first to the participants so that we know what truly are the needs that they that we could provide for them. Do you know what is that? It is NA. And I hope we have the same terminology for this. NA means more Aubrey. What is NA? We tend to give this first before giving in an intervention. NA, it is? Okay, let me say that for you. It is, yes, that's right. It is needs assessment. Okay, thank you for your answers. Anyways, thank you guys. Needs assessment. We've got to assess the need first before actually responding to the need, of course. Okay. Communities have gained much from the process of community-based research and mapping. And this has given them the avenue to appreciate and value data-driven decision-making for themselves and governing institutions. This is a report from the Philippines. Okay. This is now the call for the field of psychology to actually do a community-based research and mapping. And if I may insert and plug in what we have been doing, I do not know what is the counterpart of this subject in your different programs in the university. But in our school, we have what we call Filipino psychology. Okay? So this is the kind of psychology that would cater to the needs, the beliefs, the thought processes, and the orientation of the Filipinos. So this is the psychology of the Filipinos themselves, not coming from the West, not coming from other societies. Because we are a different people. And I know you guys from other countries right here would believe the same way. We have a different psychology as a people. So one of the emphasis right there is a community-based research. Now, if you want to provide something, do not just provide right there and then according to what you think is the need, but you actually should know first what is the need. And to be able to know this, collect data from the ground so that you can tailor in the responses. Remember, what worked for the community, let's say for example in Indonesia, might not work or might not be the need for the community in Malaysia, because we all have different needs and we have to tailor fit. Okay, we have to tailor fit the provision of support or the provision of help in such a way that we have to collect data first. Okay, so this actually starts with this one, and then some people also do some raising of awareness in different countries, in different societies, especially that I told you a while ago, some of the risk factors why cases are going up, whether physical or psychological disorders, it is because people lack the knowledge. People lack the awareness. So some are actually providing this. They are raising the awareness of the people in the locality. They disseminate information through the use of educational materials like posters and t-shirts, and they also create radio and social media messaging, okay, with the aim of passing on these messages to help their neighbors, understand how to prevent the spread of the disease. Or maybe, if not on the physical disease, maybe you can raise awareness on the mental well-being of people. That's also another suggestion, okay? That we have to raise awareness for the communities. Because up until now, people still think that when you go through a depression or when you're having panic anxieties, you're just actually faking it off. How many of you still hear that from people around you? Can you raise your hand? Do you still have friends or family members who, when they hear that a person is suffering from depression or anxiety, they would immediately say, that's just trauma. Okay, that is just it's just a thing in the mind. You can actually, overcome it, because people still lack the awareness on those things, on those stuff. Okay, 8 people. Thank you so much. You may now put it down. Thank you. All right. So that's the thing. Raising of awareness. It's also one thing that you can practice, or that you can establish the community resilience. Another is public sanitation infrastructure. Okay. SDI federations in Ghana, Liberia, Uganda, Zambia, and Zimbabwe provided hand washing facilities such as buckets and soap to hundreds of households across the informal settlements. Because the truth is, some people do not have access to soap and potable water up until this time. Okay? In Malawi, Philippines, Sierra Leone, Tanzania, and Zambia, federations provided public hand washing stations to schools, markets, communities, and centers. That's why when you go to different places right now, you can see hand washing stations right there. That is actually empowering people to be in a habit of hand washing, okay, to prevent the spread of the virus. And federations in Africa and South America also have provided about 10,000 households with hand sanitizer or hand washing materials. And they also provided nearly 25,000 masks to vulnerable community members and school children. Because some people do not just have access to this. Okay? Now, some also do the skills training. Federations have also provided skills training to community members on how to sew masks, make hand sanitizer, and sew urban gardening. From the photo, we see there urban gardening in the Philippines. It's a training. And it for the reason that it will provide new business opportunities for individuals and groups, okay? Because this has badly hit the economy. So there are also movements on savings groups, okay? Movements on savings wherein people can save up and it will get some level of interest, therefore they can get the money later on, and that's for security of finances. But be very careful because during this time as well, there are a lot of scamming activities. Like some people would tell you, okay, bring in 5,000 pesos and after 3 months, that money will double up to this and that. Okay, you know what, guys? There is no such thing as easy money. All comes from hard work. So be very careful with your investment. Be very careful with your money as well. Okay. In Malawi, the Federation produced and distributed 10,000 face masks for vulnerable community members, market users, and school children who could not afford to buy them. So by providing masks to the vulnerable, it allowed them to continue to work and use their little income. Okay, to sustain their household with the necessary food items. It has been a source of income now because of the skills training that were provided for. Now, what are the key factors that would facilitate collective actions within communities? First of all, there's a need for a strong leadership. Okay? Someone who can really initiate. And the strong leadership will be even more of it will even more be beneficial if there are also tight bonds among the people, if there's a sense of kinship at the community level, because people would feel that they are accountable and responsible to each other because of trusted communication channels. With all these factors coming together, that could facilitate collective actions within communities. And actually, I'd like to pose this as a challenge to you, participants of IB. Instead of spending so much of our time and energy on social media and trying to bash on people or whatever, I hope that we can come up with ways to actually help in actuality our communities. I know that through this convention, you'll be taught how to unleash your leadership ability and to think deeply so that you can empower the communities and that you can do something for the community. And I hope that you'll be able to come up with a program, and you will actually be presenting that program, right? So I hope that you can come up with a program that will truly help the grassroots and the communities wherever you are in at the moment. So here's what the bigger system can do. When I say the bigger system, these are our governments, okay? Those people who are in the ranks. This is what they can do, and this is what we cannot, okay? It is their part to improve the policy coherence, to localize the programs, per barangay, per locality, per small community, to address what is really the ground-based issue in each locality, and to strengthen the key systems such as food security, access to water, healthcare, social protection, and supply chains, and to attend to the vulnerable groups, making sure that no one is left behind. But here's the thing, friends. Strengthening community resilience will require a whole system approach. That means we are not going to depend it all alone to the government or to the leaders of our communities, and we'll just tell them, okay, you can do that. Please do this. No, because strengthening the community resilience is a whole system approach. That means each sector of the community has a part to play. And just imagine if these different engagements coming from the parish councils, from the local businesses, faith organizations, community hubs, and resident associations come together. Oh, what a lovely community would that be. When they come together, that would truly establish and strengthen the community resilience. Also, we must be guided by a value and a principle in making a strategic response to the community resilience in our recovery from the COVID-19 pandemic. A whole system approach to strengthening community resilience should also involve good public health intelligence. What does that mean? Okay, so it means it recommends assessing community vulnerabilities and capabilities across key economic and social indicators, that at least we have a shared understanding. I'm going back now to the needs assessment. You know what is the need, okay? And therefore, with the right information, with the right data coming in, you also know how to respond well. Now, here is what we can do. I think I'm on to my last few slides, so I hope that you are still there. Now, this is, guys, what we can do. And I hope that this can help you in your coming up with a program, because one of the workshops that you're doing in this convention is to actually make a program for the community. So first, here's what we can do. Conceptualize. All of these starts with the letter C, okay? What we can do is to contextualize, okay? To contextualize. Meaning with contextualize is know what the needs are. Make sure that the help and support is tailor fit to the need. Okay? Contextualize the help. Just like what I said a while ago, what may work for this community may not work for the other community. So make sure that you know your community well, and you are giving them a tailor fit response to their needs. Okay? Another C that we have here is collaborate. A standalone program has a difficulty in sustenance. It cannot sustain that much. But when you try to collaborate with different civic organizations, try to collaborate with government agencies, then that could mean a bigger help and support provided. So here is a challenge to collaborate. Let's say, for example, if you're going to a community, and of course you have to secure your protection or your security upon going to that place. Of course, you have to collaborate with probably the officials of that locality, okay, so that they can accompany you, or maybe collaborate with the police or the military, whatever that is, organizations that can help you do the tasks well. So try to collaborate with others. Try to collaborate with other volunteer organizations so that you can provide for their needs on a much higher level. And another C that we have here is, here's what we can do to really care. And I hope that the care comes from a genuine intention. Okay? Because when that help, when that kind of care goes through a baptism of fire, what will only stay in the end is those that are driven out of love and service. So there are some people who actually looks at volunteerism as a therapy. How many of you also here feel the same way? That when you try to volunteer, it's as if you are going through a therapy on your own. And that is why some people, when they feel anxious, when they are not okay, when they feel that they are in a depressive state, they actually intentionally go through volunteer efforts. Because when they now start to try to help other people, they also feel good about it. Okay? So that is the care. And finally, what we have is connect. What is connect? Of course, try to connect with people. And I'm moving on now to the last few things or reminders that I'm going to give you. First, it is to build stronger, more tightly bonded communities. If you really want to establish the community resilience, try to build stronger and more bonded communities, because the most significant predictor of survival and recovery is the extent to which people know each other and feel a sense of duty and responsibility to each other. Have you ever heard, I think you've heard these words, people do not care how much you know until they know how much you care. They do not care about how brilliant you are as a person, but if you start taking care of them, they will remember you. And that is what matters to them. Okay? And there is that sense of community, okay? Sense of connection. In some situations, this human connection is more important in saving lives than infrastructure and emergency supplies. You see how powerful relationships are? That it can even help you recover. So I hope that in these times where a lot of societal issues are at hand, let's not cancel friendships. Are you hearing me? Let's not cancel deep relationships, but let's try to understand one another, because at the end of the day, these connections will help us to survive and recover better. Research also says that connected, trusting, and cohesive communities where people know and care about each other tend to survive and recover better than those less well-connected within households and neighborhoods and other community networks. So actually, social connections are literal lifelines for the disadvantaged and the elderly. Let us not cut off our connections, guys, but let's even deepen these connections as it helps us survive and recover better. We need each other now more than ever. Yes. And our challenge is to find new ways to encourage and build social connections in spite of the physical distance that we must maintain to bring the situation under control. So social connection is our post-coronavirus lifeline. I started with a story and I'll be ending it up with another story. Here are redwood trees. I do not know if you have this in your country, in your countries now, but these are redwood trees, and this can extend up to 350 feet tall high. But you know that its roots are not deep because it only has about 5 to 6 feet of roots. But why is it that redwood trees are not easily shaken in times of wind, strong winds or storm? Why does it continue to stand up strong despite an environmental hazard? Why are redwood trees surviving? Do you know why? Because of this. Because of their root system. The 5 to 6 feet deep cannot actually sustain a 350 feet tall tree. But because they lack that root system down there, it cannot grow deep down there. But what they have is the intertwining roots from each other. Each tree provide strength and support to another tree beside it. So in times when the other tree might be in a situation of falling or whatever that is, the root of another tree beside it is actually helping it to stand firm on its own. You see, redwood trees are not deep. They do not have deep roots, but they have wide roots, living in an embrace of others. In a very critical time that we have right now, during this pandemic, maybe you feel that your foundation is not as deep anymore. But hey, you have redwood trees around you, okay? And their intertwining roots will help you survive and thrive during this pandemic. We just have, according to Antonio Gutierrez, we are in this together and we will get through this together. And so from our theme here in the Philippines, we hope that all together we can heal as one. Before I finally go and before I finally end this talk, I'd like you to key in on our chat box, not a fellow, key in a person, a participant that you've known yesterday probably, and that you are committed to be a redwood tree for that person. Make sure that the person is not coming from the same nationality. Okay, can you write their names down there and shout out your groups, the members of your groups, and try to give them the encouragement that you are a redwood tree and you're ready to support them. You have your roots intertwined to their roots, so that all together, despite our differences as people, we will survive and thrive together. Come on, can we do that? Shout out your new friends in this IDEEP convention. Okay, maybe they are here. There we have it. Okay, keep it coming, guys. Try to mention their names or their group names and tell them that that your roots are ready to intertwine with them so that we can get through this together. Come on, let's consider this. There we have it. Okay, I am seeing the names of their new friends. With one another, okay, you'll be able to strengthen your relationships and strengthen your friendships. Come on, keep it coming. All right, let's go. Maybe you don't know their names yet, but maybe you can mention their nationality or their group names. Yes. And of course, the start of building the community resilience starts with your group. Okay, I hope that you will flourish together as a group, as participants of this. Thank you so much for lending me your ears today, and have a blessed day, everyone. I hope that you learned something from our lecture for this morning. God bless you all.
Okay. Okay, thank you, Miss Giselle. Nice presentation and nice math lecture. Uh, I think I have one underline before we continue to discussion. Maybe the participants, you may write questions or discussion in chat box. Okay. Okay, one underline that I note about Miss Giselle presentation is the goal. The goal of we should try to encourage our resilience, yeah, through the community resilience. It's better because we are not alone, yeah. Maybe it's better because you are not alone. We in this ID, yeah, in 2022, you are not only you are not from the same nationality. I think you may building resilience together with your friends from other nationality. Okay, guys, you may write question in chat box, please, if you have any question about Miss Giselle presentations. Okay, during we wait questions from the student, Miss Giselle, in Indonesia, there are research related about well-being during pandemic. Yes, it's related with with parents. Yeah, we found that because during pandemic, we still doing about school from home. Yeah, school from home. I don't know in Philippines. Yeah, I don't know in Philippines, but in Indonesia we
Yes, we
still
also do that.
yes, still school from homes. Yeah. Parents will accompany their children to study at home during the pandemic, experience decreased happiness and happens of mild depressions. Yeah. Because before the school process before about the learns in students, 80% or more is in teacher, not in parents. But now parents should assist students or their children to learn about anything or doing school assignments and so on. So this is become impacts to parents related with depressions and their well-beings. So what do you think about it?
Hi, sir. The question is, what do I think about the situation of the school at home? Is that it? Okay.
So what should parents do during the school at home?
Okay.
So
What should parents
they can
do?
yes encourage resilience during at home. More
Okay.
happy school at home, not abuse at home.
I got that. Thank you so much. Actually, it's also a problem here in the Philippines, particularly in our school as well. We have students who have been complaining that while they are going through the online class, their parents would actually tell them to do some household chores and they would it's just that students feel that their time has not been respected, like it's more of a work to study at home than when they study in school because they do not have the focus at home. I do not know how many of the students here can resonate to that, no? But what should parents do? Actually, the thing that uh, I can actually the thing that I can actually respond to this is as a community in our school, the guidance center. Okay, please give me some time for a while. Wait.
It's okay.
Okay, so I'm back. Ayan. So, what we do in our school is that the guidance office, the counseling and the guidance office of our school um, makes or created that webinar for all the parents of the college students so that they can be the prime giver of the information coming from the students. So from that, because of the feeling that students, when they talk to their parents, they will not be listened at all. So it is now the guidance office who actually speaks on behalf of the students and gives the parents the ways on how to support their children during the studying at home that we are doing nowadays. I do not know if there are many parents who actually attended the webinar, but I think that it's a smart move for our counseling center to do that because it's different when parents tend to hear it from others more than when they hear it from their student or from their children. Okay, so as admin, the administration actually made a way to stand in the gap between the parents and the children so they can devise in some recommendations for the parents on how to respect the study time of the children. That is in the way that is on the aspect of the organization, okay, so that we can help one another. But for me, it will also depend on the kind of family, the quality of family that you have. So if you are able to express your concerns to your parents, then tell them honestly that, Mom, Dad, I needed more time to focus at home. So maybe you can give me that time. But if not, but if you're not that kind of person at home, then I think the provision of help coming from the management through our guidance center would help in this kind. So I think it will all boil down to communicating our concern. If you do not like what is happening, then communicate it respectfully to your parents. Tell them the problem, okay? Tell them your concern, and I hope that they will respond positively to what you have communicated. That would be all, sir.
Yes, but most of parents lack of knowledge about instructions. It's different with teacher. Teacher know about instruction, but parents don't know about instruction. So how to how parents to giving instruction to children during school at home.
Okay, are we referring to school-age children, like how old, or are they college students?
Some parents still working at home too. Okay.
Okay,
Yes.
because if the parents have college students, then of course, we hope that the college students are already independent learners. So what students can actually provide is not the instruction, but the encouragement and support to study. I think we have differences also in the way that we do things, right? Maybe in your university, sir, does that mean that parents take part in the instruction?
Yeah.
Okay, so
Yeah.
all right, so that's the difference. Now this is really a problem because if they are part of the instruction and if parents do not know how to do it, so I think probably the school can do some capacity building for our parents. I suggest that capacity building be provided for our parents so that they can assist well in the instruction. Because of course, how can they give something that they also do not have it within them? But if maybe they can be taught how to do or how to assist in the instruction, then maybe our parents can also do something about it, and they can also um, they can also be in the challenge, and they can also give what is demanded from them. So as a community, here is what community resilience is all about. The other part of the community, which is the school community, can actually help now our parents in capacitating them and empowering them, providing them what is needed so that they can be good parents at home that can provide instruction to their kids.
Okay. Thank you, Ms. Giselle. Okay, participant, maybe you have questions or something to discuss with Ms. Giselle. Please write in chat box.
Sir, there is somebody who DM'd me. Maybe you can you please put this for everyone to see, Frank?
Okay.
So that everybody can read it as well.
Yeah.
Okay, let's wait because he has directed the message to me.
Oh, they write chat directly to you, maybe Ms. Giselle.
Yeah, but I can read what he actually. Yes, Frank. Do you want to speak instead?
Good morning, Ma'am G, and
All
good
right,
morning,
yes.
sir. I'm having a hard time copying the text I sent, Ma'am, so I'll just unmute myself. So my question is it normal for people to experience burnout even though their service and volunteerism is done out of love and care? Because there are some people who say otherwise, that as long as you do things rooted in love and purpose, you will never get tired. So what can you say about this, po, Ma'am?
I so love the question, Frank. Thank you so much for posing that question. Okay. In the past, I also thought that when you're doing things out of love and genuine concern, you wouldn't get tired. But I came across a post that has changed my perspective on things. And it says, since we are humans, we get tired. The second thing is, it is possible to get tired because once you're doing something that you truly love, you give all your best. And once you give your best, you are letting all your resources out. That's the reason why we as humans, frailty as we are, we get tired. But it doesn't mean that getting tired is a wrong thing. So yes, it's possible to get burned out. Okay. Yes, we have that. I tell this to my students. It's a happy pagod. It's being tired, and yet you're still happy because you're doing what your soul desires. So the thing there is, if you get tired, you get burned out, then try to take care of yourself. Get in some fresh air that you need. Maybe you can halt some activities that you're doing at the moment. Okay, fill yourself up first so that when you're filled up to the rim, you can now give more to others. So I hope that answered your question, Frank.
Okay, thank you, Ms. Giselle, for the answer. Maybe you guys have any questions? You may ask question directly or write your question in chat room. Oh, okay. I think there aren't question anymore, Ms. Giselle, because you explained your material clearly. So thank you for nice material, and motivate us to building our community resilience for the next day. Uh, we do hope maybe next year or maybe in this year in endemic, you may visit Indonesia and you may come to Semarang and giving lecture in Unisula maybe in the next chance. Uh, and I do hope can visit to Philippines too because
Yes.
I haven't been in Philippines before. I haven't been in
Yes.
Philippines before. Yes. I want to visit the country as near with near in Indonesia. Yeah.
Yeah, looking forward to that, Sir Arjangi. See you
Okay.
soon.
Okay. Thank you. See you too. Okay. I will give screens to MC. Thank you for all of participants. Okay. Thank you for all of participants for your discussion too in this lecture sessions. And I give back the screens to Master of Ceremony. Okay, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you so much, Mr. Rusano Arjangi, and also Miss Giselle for the interesting lecture for us that tell us about our mental health and then our resiliency, and then she also tell about what the Filipino does with their mental health. So it's very interesting for us to also learning about their culture like that. So what next, Sister Risa?
Yeah, so since this lecture end earlier, after this we have a lunch break, but before that, we're going to
Ask them about what is their breakfast today.
oh,
Because
okay.
we want to like a reference. We need a reference for our breakfast tomorrow.
Okay. I also wondering what other country eat in their breakfast time.
Mhm.
Yeah, their traditional food, especially
Wait.
yeah.
What is our traditional food in here? Maybe we can tell them first.
I don't know.
You will show.
It's already ente. It's already ente.
So
So, in breakfast time, we eat. What is this? Yeah, what is this? Nasi kot. Okay, okay. Rice with
chicken,
dishes. Yeah, with chicken,
and then with achar.
with acar. What is this?
Achar is like a vegetable. What? Oh yeah,
Oh,
achar
yeah,
is like pickle.
pickle.
It's like vegetables that they have a sour and sweet taste, and then it's very refreshing for us if we eat some like chicken, like a bold food, so that the pickles enhance and then give a balance to our dish, so that
Yeah.
we are not throw up because the dish is very heavy, and then we have pickles so that it balances. Also,
Okay.
don't forget to drink a lot of water to take care of our immune
Yeah.
system.
But we usually also eat traditional cake, not cake. What is kue?
Apa?
Kue.
Yeah, cake.
Cake. But it's not a cake, but kue. What is kue? Not cake. It's
what are the cake name?
I don't know, like
Oh.
something like this. It's a roll cake, traditional roll cake, and
Traditional. Oh, by the way,
we have serabi also
oh,
here.
serabi. Yeah.
Oh yeah, acar.
So Charmin, no achar. Oh, we have a common dish. maybe Charmin, you can open your mic. What is achar in Bangladesh? Is it same like a pickles? Charmin?
Yes, it is same pickle we called, and sour in taste, sometimes sweet or spicy.
Wow.
So I think same dish.
Oh, same dish. What usually vegetables in
The
the
contents
achar?
in achar.
Yeah.
Mango.
Oh, wow.
Then just what should I say? Many fruits and many veggies. Sometimes we eat spicy achar with the green chilies.
Oh.
So many things.
Many things.
I couldn't say that many items now. So
Oh.
many things we make achar in our country.
Okay, so achar can contain variety vegetable, right? Yeah,
And also fruits.
Yes,
yeah, and
yes.
also fruit.
Wow.
Oh,
Thank you, Charmin.
Thank you. And Faria said that
She can make
she can make
achar.
achar. She or he? Group 9 Faria Rahat said that she can make achar. Wow. Do you also can make achar?
We just can
Eat
achar. We will
Cannot
help
make-
you. We will help you, Faria.
help
We
you
will
to
help
eat
to eat
your achar.
and empty your plate, your
Sure.
achar plate.
Okay. And Afika Zaidi said that in Malaysia there are nasi lemak, roti. Oh yeah, roti canai, kue. Yeah. We also call kue here, kue. Yeah.
What is kue? I don't
Kue.
know.
It's a cake. Not definitely a cake, but it's different.
It's like a cake that called
kue.
Oh,
Yeah.
so
Kue.
what kue? Like it's from flour or it's from maizena or it's from what?
No, it's
You don't know the
I
ingredients?
don't know. I don't know.
Okay, maybe
I don't know
will-
actually. We'll
I
just
I will learn about my traditional food.
yeah. And teh tarik. Oh yeah.
Yeah, I love
I love teh tarik.
We love
Milo. Yeah.
Milo and kaya toast.
Kaya
Oh
toast,
yeah, we have it here. Yeah, it's similar. And then there is Filipinos version of achar. They call it
Oh.
achara.
Acara.
Is it right? Is it right? Our pronunciation achara. Lea Marie, can you teach us
Yeah,
how we pronounce achara? It's achara or like achara or like achara.
Yeah, you pronounce it correctly. It's acara.
Acara. In Indonesia, acara means event.
Yeah. Achara.
Okay.
We have achara too.
It's
Pickled
today.
papaya. Oh, pickled papaya.
Pickle papaya. It's today International Pickle Day. You name it.
Oh,
Okay.
traditional cake.
Yeah,
Yes.
traditional kue is traditional cake. My favorite traditional cake that come from Indonesia is luti gendang is one of my favorite traditional cake. It's from Batam, Kepulauan Riau. Yeah.
And my traditional cake is lumpur.
Kue lumpur.
Yeah.
Oh,
Have you heard
yeah.
kue lumpur?
Yeah.
My mother make kue lumpur, so I hope sometimes my mother business become international.
Go international so that
Yeah.
you guys can try it also.
Yeah, you guys can try my mom's cook lumpur, curry puff, and all
Oh,
of this
yeah.
stuff. Yeah.
Yes, we also want to try. Invite us.
Yeah, I will invite you. Definitely. I will invite you. You come to Semarang first. And I will give you a lot of lumpur and curry puff.
Yeah.
Maybe you can help us to sell in Bangladesh to expand my business.
Yeah, sure.
And I will sell your pickles in Indonesia.
Yeah, okay. Okay, di ba?
Sorry. I'm so excited.
Oh yeah, yeah. I guess. Oh yeah, I want to know in another country what your traditional food um from Mongolia maybe.
In Mongolia, I hear there is meat noodles.
Meat noodle.
Like I watch on MasterChef Indonesia, and
Ah,
there is a participant that cook Mongolian noodles.
what it's called?
Mongolian noodles.
Mongolian noodles.
Yeah, it's called Mongolian noodles.
Is that
But
true?
but I don't know. Is it true or not? Maybe the
Our
participant
Mongolian friends, could you please
give a clarification.
clarification?
They're Mongolian noodles. Like because I saw it and it's very tasty. And oh my god,
oh
I
my
want
God.
to try that, but I can't.
Anything, I think everything you eat is tasty.
Yeah, because
Because
I don't know.
there's only tasty and delicious
Delicious.
in Paradiba dictionary. There is no delicious, no.
It's okay if you like to eat. It's for our well-being. Maybe the Mongolian is not here. So maybe
Oh.
we will try to ask Philippines about their traditional food. Malaysia, maybe we have a similar traditional food, right?
Yeah.
And then what is Philippines traditional food? She has a. Oh my God, you are so kind, Charmin. You can replace Sister Risa in here. You're so kind. Thank you. She has a good taste buds. Yes, I am definitely. You can replace Sister Risa in here. Oh my God, go away, girl.
We have adobo from Philippines, and I can
Oh,
smell it right
adobo.
now from our kitchen. Wow, wow, it looks nice. Can I searching adobo? What is adobo?
I heard it. It's there are various adobo, if I'm not mistaken, like chicken adobo
Chicken adobo.
and then pork adobo. Yeah.
Oh, wow. Adobo or adobar is the immersion of cooked food in a stock composed variously of paprika, oregano, salt, garlic, and vinegar.
Oh, vinegar.
Vinegar.
Is it like a sour dish or because it contains vinegar, right? Maybe Aubrey, is it like sour or what's adobo taste?
Hello. It's a combination of a soy sauce with vinegar. Then, yeah, it's sometimes we're putting sugar. So like the taste is really good.
Oh my God, I want to try it.
I'm hungry. I'm currently hungry. I'm already hungry. Oh, in Farid say that is it kind of like samur? Samur is a sweet kind of food from Indonesia.
It contains a lot of sweet
Soy sauce, I guess. Is that
Sweet.
soy sauce?
soy sauce.
Yeah, it's basically dominated by soy sauce.
But I think samur but there is no vinegar in samur.
Yeah, there's no vinegar.
And then I curious like afridata.
Afridata. What's
and
afridata?
sinigang.
Okay, let me search. Afridata.
Maybe Frank can help us to
To explain what is afridata and how it tastes.
Yeah, and sinigang.
Ano, afritada is actually a Filipino dish, but I really don't know what the ingredients are because I don't know how to cook it. But
Same here.
it's chicken with tomato sauce and I guess potatoes, and it really tastes good. So I guess you can try it when you come here in the Philippines.
Sure. And
It's very bright, right? Because it contains tomato sauce. It's
Yeah.
like a red dish, very bright dish.
Yeah.
Frank?
Right
Yes,
color.
yes, yes.
Oh, okay.
Color
And
orange or red.
Orange.
oh, very tasty.
Wow.
And what is sinigang? Gabriel wrote sinigang. What is sinigang?
Hello. So sinigang is basically like a stew with you can use like for example beef meat and then you stew it and you put tamarind in it. So it's
Tamarind?
sour, yes, very delicious and it has various vegetables like eggplant, tomatoes.
Wow. I love
Yes.
eggplant.
Oh my God. I want
Very
to try
delicious.
there.
Yeah,
Oh,
very delicious.
Yes.
I can feel it by imagining it.
I can imagine it. I have to taste it.
You will someday.
Yeah,
Yeah, I will.
someday. I mean, thank you, Gabriel. And Sansar must say Mongolian people love meat, so most of their food is meat. Buzz. Oh wow, meat. I also love meat.
Buus and
How do you
usur.
spell it, Sansarma? Buz and Husur? Is that is that correct?
Yeah, it's at first, but kosher. It's a
Kosher.
Mongolian traditional food.
Wow.
Yes, very delicious, and I love it so much.
Wow.
Wow.
I think if
We
I
have to-
try it,
Yeah, we have to share that, definitely.
yeah, we have to searching it so that we can imagine it.
Can you name the ingredients in buus and usur? Because we want to sell it in Semarang.
Wow. Oh, so buz, it looks like
Dumpling?
dumpling.
Is it a dumpling?
I don't know dumpling.
Oh,
Oh,
but is it like wrapped in some
steamed
of?
dumpling? Yes.
Is it wrapped in some of skin and then there are meat inside it? Because we saw it in Google, like.
Mm. Oh, okay.
Yeah,
Wow.
it's very delicious. We saw it on
delicious. I love
Google.
it. Wow.
And most of people eat meat and horse,
Oh, meat and what?
sheep,
Cheese?
sheep.
Sheep. Oh, I
Oh,
haven't
sheep.
tried sheep.
What is sheep? It's like kriuk, krauk.
Sheep. Sheep is
Oh,
domba.
sheep.
Domba.
Sound the sheep.
Sound the sheep.
Is that you mean it? Like sound the sheep?
That's what you mean? Sheep. Sound the sheep.
Oh, sound the sheep. The sound
Yeah,
the sheep.
shown the sheep.
Sound the sheep.
Oh.
Diba is confused. Like
I think
is
chips.
sheep is cheap? Cheap? No, it's sheep.
It's literally sound the sheep. That's my
Bebek,
yeah.
yeah.
I know, Farid. I'm not that dumb. Yeah, I know sound the sheep.
And
Sound the sheep.
Afika said that we Asian eat heavy meals for breakfast. Yeah, that's right. Cereal, milk, and full of it. Yeah, indeed.
We can't diet in here.
I can diet in here. Diba already eat for 2 box that contained
It's like
4 traditional cake, guys. Oh
and
my
one
God.
pie and one pineapple pie. But it's okay. It's for my well-being.
Comfort food.
Yeah, it's the comfort food. Afika, where are you come from? Like Malaysia?
Malaysia. Afika from
Yeah,
Malaysia.
I'm from Malaysia, guys.
Oh, you're from Malaysia. We have a same similar food.
Similar food, yeah.
Yeah, our culture is like almost similar. Like
Yeah.
we share some things, but we won't claim
Yeah.
ours. It's yours. It's ours,
Yeah.
right?
Yours.
Yeah.
It's yours and it's ours and yeah.
It's our it's our no.
And there are Malaysia, Philippines, Vietnam. What is the traditional
Foods
food
of Vietnam, but let me searching it. Or if you guys have any idea of Vietnam food, please help us to mention it.
Vietnam is popular for rice, right?
Rice.
Yeah.
Oh, I know Vietnam food. is
What?
po. Is that right, guys?
Oh,
Po.
po.
Oh, right.
It's like a noodle, right?
I don't know.
Rice noodle.
But yeah.
Yeah, it's heavy breakfast, but we do good exercise. Good, you have to do exercise.
I think Sansarma love exercise so much. I don't like exercise.
I don't like to. So
Yeah, I
that's
like
why,
to sleep, not exercising.
Yeah, that's why my
And-
body is like bloating everywhere.
Fat
it's okay.
everywhere.
But it's okay.
Yeah.
As long as we health, right, and happy.
How do we become health when we don't exercise?
Oh yeah, no.
By eating
By eating
healthy
but-
food.
But we have to exercise, right, to
Yeah.
complete our mental health.
Mental health. Anything is about mental health
Yeah.
here.
What is Vietnam, guys? Please answer me. Anyone know the
Vietnam food. Po. I told you po about po.
Oh yeah, po.
Po. Do you wanna see it, po? Do you wanna see po? Oh, it looks like this.
PHO, right?
Yeah, PHO.
Oh, it's like
It looks healthy. Wow.
yeah.
And tasty.
Is it in Indonesia we call it bihun?
Oh, yeah.
It's like a bihun, right?
Yeah.
So po is Vietnam noodle soup, and it's from rice noodle, and it's like in Indonesia we call it bihun, like a rice noodle. We call it bihun. Rice noodle or corn noodle, like
Yeah.
the starch from the corn.
I don't know the ingredients.
Yeah. Okay. And then
Okay, what about we're talking about their traditional uniform?
oh yeah.
Yeah, I'm wondering what is your traditional uniform, guys?
Would never. Yeah, please.
Well, never. We will never exercise. Oh my god.
My God, you too, Farid.
Okay.
What is traditional?
Your traditional uniform? Let me know.
Why we ask this? Because after the lunch break, we will do some culture exhibition. We will share you guys to see. We will share the screen. We will share the video and the performance. It's maybe live performance or video, just a video. We will share to you guys, so you guys can see what is like the culture
Of each country.
Yeah, of each country. Yeah, each country. Is
Yeah.
Asian?
Each country.
Oh, each country. I hear each country.
Why do you so?
I don't know.
Okay.
So because our headphone is not good. So
Okay, since next we will have a cultural exhibition, I want to know that do you guys already prepare for your performance or videos that we will show in the screen from Malaysia? Do you guys have prepared the performance video?
Yes.
Yeah.
We uploaded to the Google Drive link.
Okay.
wow, is it live?
nice.
Is it like
Is it live
your-
performance?
It's a pre-recorded.
Oh,
Yeah.
recorded.
Wow.
So it's you and your friends before.
It's actually we edited some videos, but some of our voices are there, but not
Oh.
photos or videos.
Oh, I can't wait to
Can't wait.
watch your performance video.
Yeah, I hope you
Yeah.
guys enjoy it.
Yeah,
We will enjoy. And yeah, we will watch it.
Yeah, we will watch it while it.
While eat our traditional food, our lunch food. Okay. For another country,
Philippines maybe.
Philippines, are you guys already prepare your performance video?
our performance video is also uploading right now, and we're so excited to share it with you all.
Is it
And
your
wait.
performance or live or
It's a pre-recorded video, and you will see the faces of my fellow psych majors. See.
oh, okay. It's very
Okay.
interesting.
Very interesting. Thank you, Gabriel. And from Indonesia, from Indonesia, from Indonesia,
I
are
would
you
like-
guys ready for the performance video?
Devi Rahayu, are you there? My friends.
My friends, Devi Rahayu is the best friends, guys.
Yeah, my classmates. But she's not here, I think.
From Indonesia.
Maybe we
Indonesia.
can ask the buddies
Buddies.
coordinator. Aldia, our coordinator. Our
Is
buddy
Indonesia
coordinator.
already upload the video performance? Aldia.
She's not here also.
Oh my god. Oh my god.
Yes.
Oh my god, Aldi, you leave us.
Sorry. Yeah, is Indonesia already upload the video performance? Oh,
Yeah, they
okay.
uploaded it already.
Okay, nice. Cannot wait. Is it a video or a performance?
I haven't watched it.
Oh, you haven't watched it. Let's watch it together.
Yeah.
Better. Okay, thank you, Aldia. How about what else?
I think there
Bong.
is country that want to serve us live
What
performance.
performance? Is that Bangladesh?
Yeah, from
How about
Bangladesh.
Bangladesh?
Maybe we can ask the preparation about your signal in there. Is it stable enough
Stable enough to perform.
to perform the live performance? Charmin, are you there?
Charmin or another Charmin's fellow?
Oh, live.
Maria Rahat.
Are you guys together in one place? Is it?
Yes. We're doing live performance. Me and Charmin.
Oh,
Oh,
you
you and
Charmin.
Charmin.
What will you do? Like sing or?
Dancing.
No, actually, we have made a slide
Yeah.
video and the
And
pictures
I
of
would like to add, I would like to sing one of our traditional song.
Wow.
Little bit.
Oh my God. There are a participant that give erection for you guys.
Yeah.
Give erection.
Give erection. Me also.
Uh,
Give erection.
Is it your signal in there is stable?
Stable enough.
Is it good enough to perform? I hope so.
I hope so. We do hope so.
Yeah, we do hope so. Are you in Charmin home, Faria, or Charmin in Faria's home?
No, no.
No.
Are you in your university?
No, actually, we're staying our own home.
Oh, yeah.
Oh, okay. It's very interesting.
It's very interesting.
We will tell our operator to spotlight you guys.
Okay.
Charmin and Faria later in the
And the
performance.
other participant also.
in the live performance. So
In the
that,
live performance, okay.
yeah, so that they can see Charmin and Faria.
Okay. Ay,
Not now, not now.
not
Later.
now.
In the perform- our operator is very interesting. Guys, they are very passionate
Yeah. They really cannot wait.
about your
The
performance.
exhibitions.
We can't also.
Okay. We will see.
Okay, thank you Bangladesh. How about Mongolia? Sansarma? Sansarma, right?
Oh yeah, Sansarma.
Mongolia. Hi Sansarma.
Hello.
Prepare for performance or cultural exhibition, Sansarma?
Yeah.
What will you bring? Is it a video or a live performance?
Video.
As a video. Okay, that's fine. Astaghfirullah. Someone is sneezing here, and I'm
Very
shocked.
loud.
Yeah, very loud, like shock.
Sorry for the inconvenience, guys.
Okay, and I want to know, I want to learn your language actually. Could you please, from each country, could you please teach us your language, your sentence? Teach us, please,
To say
to
hello
say hello, greetings,
or I love you.
or I love you, or are you hungry, or when we have our lunch break time.
Mabuhay. What is
Mabuhay.
mabuhay?
Mabuhay.
Aubrey. What is mabuhay?
Mabuhay is like sorry. Mabuhay is like hello or like just hey, welcome or anything.
Oh, okay,
Usually
okay.
use it for greetings.
Oh, okay. Mabuhay.
How we like the
How we say it?
intonation?
The
Yeah.
Indonesian.
It's
The intonation.
mabuhay.
Mabuhay.
Like if there
Mabuhay.
are visitors, like we say from the airport, usually there is mabuhay, welcome to the Philippines, like that.
Gesture will be like this. Mabuhay.
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 Wow, mabuhay. Mahal kita. What is mahal
Okay,
kita?
thank you, Aubrey. Mahal kita is love you.
It's from
Is I love
Philippine.
you. Right?
Is it from Philippines?
Mahal
Yes,
kita.
that means I love you.
Oh, I love you too. What do we say? What the response of mahal kita? Mahal kita too?
Mahal din kita. Mahal rin kita.
Mahal din
ganun.
kita.
Mahal rin kita.
Diba mahal kita?
I hate you. Maganda. What is I
Maganda.
hate you in Philippines? Please tell me. Please tell
Don't
me.
tell her. Don't tell her.
Aubrey mahal. Maika mahal kita karena talaga. I don't know.
Maika mahal kita karena talaga. Am I correct?
What is I hate you in Philippines? Please tell me, guys. I want to replace Sister Risa.
Maganda ka.
Oh, maganda ka.
Maganda ka is I hate you?
Maganda ka is I hate you? Oh, pretty.
It's pretty.
You are mahal.
I'm maganda ka. I'm maganda ka.
Yeah, you are maganda ka.
What is ugly in Philippines?
why we ask them some a bad word? Oh my god.
Okay.
No.
Oh, okay. So
We
I
will
heard
pause.
that. So I heard that Miss Giselle wants us to take a picture together, guys. So please turn on your camera because we want to take a picture.
Hello, Miss Giselle. Are you there?
Hello, Miss Giselle.
Whoa. Sorry, guys. Hello, Miss Giselle. Are you there?
Yes.
Okay, we
Okay,
will
Miss
start. Maybe our operator can help us to take a picture. So you guys, please open your camera.
Open your camera. Gorgeous.
Oh my god, so beautiful.
Beautiful. Miss Giselle is beautiful. Maganda ka.
Maganda
Wow,
ka.
thank you. Salamat.
Salamat.
Okay. So, are we ready, operator? Okay. So, please wait.
While we wait, maybe you guys can open your camera.
And
Arrange your hijab.
yeah, arrange your hair, your hijab.
Wear a lipstick.
Wear a lipstick.
A powder. A brow.
Oh, I will count in 3, 2, 1. Okay. One more time. Okay, one more time, guys. 3, 2, 1. Okay, thank you, Miss Giselle and everybody. Huh?
Oh my god, everybody is very gorgeous.
Next slide. Sorry, guys.
Sorry, guys.
Screen.
One more time. Next slide, guys. I'm sorry, Miss Giselle. Next slide, guys. I didn't know where slide you guys.
The second slide. 3, 2, 1. Third slide. 3, 2, 1. Okay. Repeat. Repeat. Okay. One more time. 3, 2, 1. Okay, gorgeous.
Thank you,
Thank
Miss
you, Miss
Giselle.
Giselle, and
Thank you
everyone.
so much to
Miss
our
Giselle.
hosts, our very beautiful hosts.
Oh my
You
God.
too.
Miss
Ma-
Diani, Sir Rosena, thank you so much.
Yeah, thank you, Miss
See you
Giselle.
around.
Bye.
Bye.
Maganda ka. You are very maganda ka. Oh my God.
Thank you so
Oh my
much.
God. Okay.
Belum bahasa lain nih, belum.
Okay, guys.
Bahasa lain.
Oh, so we will continue to learn another language from another country.
Please. Sorry.
What is maybe we will learn from Bangladesh. Is it you use Indian language or Bangladesh Indian, right? They use Indian language, right? What language are you use in Bangladesh? Charmin or
we use Bangla.
Oh, Bangla. Can you tell us how to say hello
in Bangla?
তোমাকে স্বাগতম.
Can you type in the chat box?
On the chat box, please.
They say once again.
Can you type the word on the chat box?
In Bangla.
Yeah, in Bangla.
Okay.
No, in Bangla we can read Bangla in alphabet.
Maybe Bangla in English and English letters.
Yeah, Bangla in English letters.
Okay.
Oh my God, we will be smart in here.
We'll be smart. Maganda ka. Mahal rin kita. Mahal kita. Mabuhay.
Mabuhay. Mahal kita. Mahal kita is I love you, right?
Right.
Okay.
And also, I want to, after this, maybe I want another country to teach us another language. Malaysia, I guess.
Tomake sagotom. Is it?
Tomake sagotom. What is tomake sagotom? Tomake
It's like
sagotom.
hello. It's like hello in Bangla, right, Charmin? Oh, saying
yeah,
hello.
saying hello.
Can you repeat the pronunciation and the intonation to say tomake?
Tomake sagotom.
তোমাকে স্বাগতম.
Sha.
Sagotom.
Oh, sha. Tomake shagotom.
Charmin.
Tomake shagotom, everyone. Thank you, Charmin. Oh my God.
If I refer to everyone, then it will be সবাইকে.
Shobaike.
তোমাকে means you. তোমাকে means you and সবাই মানে we সবাই.
Oh, tomake means you. So if I want to mix Bangla words and Philippine words, I can say tomake maganda ka. You are beautiful. You are beautiful. Tomake maganda ka. What is can you repeat hello for everyone?
Hello, everyone.
সবাইকে স্বাগতম.
Shobaike shagotom. Shobaike shagotom. Shobaike shagotom. How we say it, I am hungry. I am hungry.
খুব ক্ষুধা লাগছে.
What?
খুব ক্ষুধা লাগছে.
Kuda lakse. Is it right? Kakak, you are mute.
I'm sorry, my bad.
Kuda lakse.
ক্ষুধা লাগছে.
Kuda lakse. Oh,
Kukuda lakse.
Kukuda lakse.
Yeah, much better.
It's already empty. Kukuda lakse.
Kuda lakse. And how we say what? How we say I love you in Bangla.
তোমাকে ভালোবাসি।
Tomake bahalobashi.
Tomake bahalobashi.
I'm a
You are
good
so
learner.
good.
Yeah, I'm a good learner.
You are a good learner. Sister
Yeah.
Isa is very good learner. Tomake also tomake means you.
Yeah, tomake
You,
means
yes.
Oh, tomake magandaka.
But I already forgot. What is it?
What we say in Bangla if we will say you are so beautiful.
তুমি অনেক সুন্দর।
What?
Sorry?
তুমি অনেক সুন্দর।
Tumi onek shungo.
সুন্দর।
Shundun.
Shundan.
সুন্দর। তুমি অনেক সুন্দর।
Tumi on.
Tumi one shundan.
Shundun.
Oh, tumi
Oh,
one shundan.
Shundun.
And in Bangla, it means that in Bangla they have like their own words, like no, their own alphabets.
Oh, yeah, I guess. Like Mongolia, right?
Yeah.
I don't know.
In
Maybe.
Bangla, you have your own alphabets to write.
Yes, we have our own alphabets.
Oh, wow. Same as Mongolia.
Yeah, same as Mongolia. Wow,
Yeah,
it's
wow.
very interesting.
Interesting.
Oh, wow.
Thank you, Charmin and who?
Yeah.
Charmin only.
And also.
Oh yeah, thank you all guys. Okay, how about in Malaysia? In Malaysia?
Yeah, in Malaysia.
Okay. Malaysia.
Even if our culture is like a similar, but there are a lot of different words,
Yeah.
different language, right?
Difference.
Hi.
Hi.
But I very like it's a very interesting for me to hear Malaysian people talk because I like it. I don't know. It's like, oh my God, it's a beautiful, I think.
Okay.
Yeah, your language is beautiful too.
Oh my God.
Actually, I think our greetings is
same.
very similar to Indonesia.
Yeah.
Like for the Malays, we usually give salam as greetings.
Yeah,
Like
assalamualaikum.
assalamualaikum. But if we want to welcome people from other countries, we would say selamat datang.
Yes,
Oh
selamat
yeah.
datang.
It's very similar, right?
Yep.
But for those from other races like Indians and Chinese, I'm not quite sure because usually if we speak with other races, we would speak in English or in Malay.
Oh, yeah.
So that it means that in Malaysia we use English for daily basis.
Yeah, English and Malay.
English
Oh my
and
God.
Malay.
No wonder your English is very good.
Very
girl.
good.
Yeah.
Oh, thank you so much for the compliment.
Yes.
How we like?
Do you, would you want to have a conversation with? Who is this?
With
What's your name, girl? What's your name, girl? Afika.
Yes.
Do you want to have a conversation with Afika?
About what?
Anything in Malay.
I can't.
I can.
I think it's better
Okay,
to use Mr. Risa because
nak cakap pasal apa?
Nak cakap pasal
nak
apa?
cakap. Okay, I will try.
Aduh, I'm confused suddenly.
Nak cakap masalah makanan. Makanan. Is it
Makanan.
Is it
No.
true like in Malaysia we add like kayak
Yeah.
makanan?
Yeah, for like like saya, you
Yeah,
guys say
saya.
saya, right? We do
Tak nak,
saya.
tak nak.
But like not for everything lah.
Not for everything.
Like Malaysian, our like signature, we always put like la.
Lah.
Okay.
Aku lapar lah.
Awak nak apa?
Betul.
Awak nak makan apa?
Yes.
Oh my God, you're so good, sister.
That's the exact pronunciation.
Yes. I'm a good learner.
I want to try in Indonesia.
Oh, you want to try Indonesia?
Yeah, in your language. Awak nak makan
Okay.
apa kan? Kamu mau makan apa?
Saya mau makan nasi Padang.
Nasi
Kamu
Padang.
pernah makan nasi Padang?
Iya pernah. Saya pernah ke Jakarta, ke Bogor, dan ke Bandung.
Oh, kamu makan apa di Bandung? Itu ada acara apa di Bandung?
Family holiday.
Oh, holiday,
How do
liburan.
you say it in Indonesia? Liburan, ya liburan.
Oh, liburan. Kamu di Bandung makan apa?
Ya kalau kegemaran saya di sana tahu yang di tepian jalan.
Oh, yang di
Tahu
Ah, what is tahu in your language? Tahu also, right?
tahu.
Yeah, tahu goreng.
Tahu goreng.
It's like a
Yeah,
tofu, right?
tofu.
Yeah.
Makan sama itu chili.
Oh,
Cabe.
tahu dan
Cabe, iya cabe. You guys call it cabe, yeah.
With
Impressive.
just tahu and chili, or tahu with some soup and chili?
No, just tahu with chili.
Oh, it's like yum 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 yum.
Yes,
like that?
yes.
Oh my god.
Oh, jadi kamu pernah ke Bandung?
Yeah.
Wow, aku juga pernah ke Johor dan Malaka.
Oh, that is like the like western side of Malaysia.
Oh yeah.
You can talk with Malaysia with
Afrika.
With Afrika, like talk about Johor and Malaka.
Dekat Johor awak pergi mana?
Dekat Johor, saya pergi ke hospital.
Oh, hospital.
Yes.
Awak melawat ada saudara ke?
Melawat. What is melawat?
Melawat is mengunjungi.
Mengunjungi, ziarah.
Oh, it's like visit.
Visit, yes.
Oh.
Visit.
It's kind of different from bahasa Melayu in Indonesia. So there is also bahasa Melayu in Indonesia, right? But it's quite different. So like melawat,
we share some similarities, but there are also differences.
Oh,
But
yeah.
I think Malaysian understand Indonesian language because we grow up with lots of sinatrons.
If Indonesia go there and then I talk like Indonesia, is it like they understand about what I'm saying?
Yes, absolutely.
Oh,
Unless
I will
you
go
got
there.
like a different kind of accent or like maybe Javanese.
Oh, you understand Japanese?
I understand a little bit because I am from a Javanese descent also.
Wow.
But like most Malaysians maybe wouldn't be able to understand Javanese.
Oh, what is your language? What Japanese language that you know? You know mangan?
Mangan ya makan.
Yeah, mangan.
Wes mangan, wes suara.
Impressive. Oh my god.
You are language genius, girl.
No, it's just that I'm born to the family, so it's only natural for me to understand.
Oh,
but I can't really speak because I'm ashamed if I got the wrong pronunciation, so I rarely use Javanese language. But my family, some of my relatives, they are still using Javanese language in a daily conversation. Yeah, so I understand a little bit.
But your pronunciation is good, girl. You have to practice.
I tried.
Okay, practice it with us.
Yeah, your parents come from Japanese or?
I think like my great grandparents, they were originally from Indonesia and migrate here to Malaysia. So we still bring our Javanese culture, like our food, language. We still preserve some of the, but also with the mix of modern kind of Javanese.
Oh, so for you guys that didn't know what is Javanese language, it's like in Indonesia, we have a lot of language other than Indonesian language. We have Javanese language, we have Sunda language,
Melayu language.
Yeah, Melayu language.
Batak language.
Yeah, Batak language. Indonesia itself, we have a lot of bahasa or language in here. So yeah, local language. So I'm very glad that you know one of our language, like which is Japanese. Majority in Indonesia we use Japanese because the majority people in here are Japanese people.
She's Japanese.
Yeah, I am a Tulen Japanese. I'm a true Japanese.
Pure.
I'm a pure Japanese.
I can practice with you then.
Yeah,
okay, sure.
You can call me. You can WhatsApp me.
Yeah, we converse in Javanese only.
Okay. I will when
Malay.
I go to Malaysia, please teach me Malaysian.
Of course, anytime.
Okay, thank you.
Okay, thank you, Afika. Nice to meet you.
Thank you, guys.
Okay, so I guess
I'm hungry.
Okay,
Saya lapar.
saya lapar, not
saya
lapar.
lapar.
Saya lapar.
We can't say R in the last word,
Yeah,
like
lapar.
lapa.
Right?
Is it lapa?
Not lapa,
What?
but lapar.
Lapa. Okay.
Saya lapar.
Saya lapar. I'm hungry.
Okay.
Saya lapar.
Okay, guys. Well, I guess it's enough. We'll continue later in cultural exhibition, but beforehand we will have lunch time, yeah, lunch break for you guys since you guys are hungry, yeah.
Or just want to take a rest?
Yeah, it's all up to you. But yeah, okay. See you guys at 13 p.m. Indonesian time, GMT +7.
Have a lunch. Have a nice lunch.
Selamat makan, everyone. Have a nice lunch.
Have a nice rest.
Bye.
Bye.
See you again.
You guys can chat in chat box like bye or selamat makan in your have a nice meal in your
Language.
Have a nice lunch. Okay, thank you, Sansarma.
Yep. Selamat makan. Have a nice lunch. My eyebrows. Oh my god. Happy lunch, everyone. John Ria.
Okay, see you. Bye bye.
See you, gorgeous.
Gorgeous. Slide.
Pet fore kao.
Pet.
Okay.
Slide.
We will end the meeting.
Bye. See you guys.
Assalamualaikum.
Wassalamualaikum.